Peacock. This morning we're going to treat a patient with chronic metatarsalgia and also predislocation syndrome with a plantar plate tear of the second metatarsal. We're going to do this through minimally invasive surgery. Let's start by just looking at our x-rays here. You can see with her x-rays, her parabola is a little slightly off. You can see she has a fairly long second bone, a long third bone. One of the things that makes her condition fairly significant here is that she's had an injury before in her ankle. You can see some of the hardware still left in the ankle here. So what she has is a bony blocking equinus. So even though she is an equinus patient, we can't do a gastroc resection to relieve her pain because that wouldn't work for her because it wouldn't get any more motion in the ankle. So let's just take a look at her foot and I'll show you what she's got going on. In the bottom of her foot, she doesn't have a lot of lesions or anything. Most of her pain is in the second met. If you put her in neutral position and place her in the Peacock press, she has an equal first ray motion, so we press down a little bit on the first ray. You don't see a lot of blanching like we normally see with people that have IPKs. Now if you take the ultrasound and look at this in this position, this is what we're getting in the ultrasound. You can see the inflammation around her second metatarsal. This is medial, and you can see we got a 0.63 measurement, and the third met is 0.57, and our fourth met is 0.87. So in this patient, even though we do have equinus, which we can test by trying to push up, basically treating her gastroc wouldn't work because this is a bony blocking equinus. So we know we have pretty good range of motion in the first ray here and also in the fifth. So what we're going to do to correct her condition, we'll do metatarsal osteotomy on the second, third, and the fourth to allow these bones to seat in a better position. And we're going to correct this drifting second toe. If you look at the front of her foot here, you see when we put pressure, you see how her toes drifting towards her her hallux here. What we're going to do with that is a slightly modified Isham procedure that will allow us to have this toe go lateral. We're going to do the same thing to the third toe and possibly the fourth toe. So we're going to correct her metatarsalgia by both soft tissue corrections of the toes here and also metatarsal osteotomies. Good morning, I'm Dr. Peacock. This morning I want to show you a patient we treated with metatarsalgia, and the point of this video is to show you how you can do a lot of surgery with minimally invasive surgery and not have a lot of post-operative pain. Let's look at our x-rays here. The patient had a plantar plate tear in the second MPJ joint and a lot of forefoot pain in metatarsalgia, mainly because she has some reduced fat pad. And the other thing is that some years ago, if you look at this x-ray real close, you see where she had a fairly significant ankle fracture. And this left her with a bony equinus. So she has the equinus, so it's more of a bony equinus. So we opted to treat this with minimally invasive surgery. Now this is 1 week later. What we did with her, we created all her hammer toe deformities. You can see our osteotomies through here. And we did osteotomies on the second, third, and fourth metatarsals. Now obviously this is a lot of surgery. We did surgery on 2 through 5 hammer toes and osteotomies 2, 3, and 4. And normally people with this type of surgery, if you did this traditional, it would be quite a bit of pain and swelling. But let's show you her foot. This is only 1 week later. If you look at her foot here, you can see that the top of her foot here, these are our small little incisions here for the metatarsal osteotomies, which we did in an oblique fashion. And we have a couple little suture areas on the side of the toes here, where we did our where we actually performed our osteotomies of the second, third, and fourth toes. Now, once again, with this, you would expect this to be quite swollen and painful, and in traditional procedures it would be. Let's just talk to our patient right now. This is our patient. Let me ask you this: how many pain medicines have you had to take so far?
Not any.
So you haven't taken any pain medication?
I haven't taken any pain medication.
So is your foot really sore? Is it painful? What would you describe it?
My foot is sore when I stand on it.
But it's not real painful?
But it has never hurt. I just never had to take any medication for it. Right.
Well, obviously different people have different tolerances to pain, but normally if you were to do 2, 3, and 4 osteotomies of the metatarsals traditionally, you probably have to take pain medications. One of the advantages of minimally invasive surgery, if you pay close attention to the tissue planes like you do in traditional, but do your cuts with minimally invasive techniques, you get a lot less swelling and a lot less pain with these minimally invasive procedures.